just jog a little bit. Just tell us a little bit about substance use disorder.
The substance use disorder is a very broad term that describes any substance you use, whether it be alcohol, marijuana, fentanyl, heroin, cocaine, meth, anything that you use and then it has an adverse effect.
ਜਿੱਦਾਂ ਇਹ ਦੱਸ ਰਹੇ ਨੇ ਵੀ ਸਬਸਟੈਂਸ ਯੂਜ਼ ਡਿਸਆਰਡਰ ਇੱਕ ਇਦਾਂ ਦੀ ਚੀਜ਼ ਹੈ ਕਿ ਬ੍ਰੌਡਲੀ ਟਰਮ ਆ ਜਿਹਦੇ ਵਿੱਚ ਕਿਸੇ ਵੀ ਤਰੀਕੇ ਦਾ ਕੋਈ ਪਦਾਰਥ ਜਿਸ ਦੇ ਵਰਤਣ ਦੇ ਨਾਲ ਤੁਹਾਡੇ ਰੈਗੂਲਰ ਰੋਜ਼ਾਨਾ ਦੇ ਕੰਮਕਾਜ ਦੇ ਉੱਤੇ ਤੁਹਾਡੀ ਜ਼ਿੰਦਗੀ ਦੇ ਉੱਤੇ ਹਰ ਇੱਕ ਚੀਜ਼ ਦੇ ਉੱਤੇ ਜਿਹੜਾ ਅਸਰ ਪੈਂਦਾ ਆ ਸੋ ਉਸ ਨੂੰ ਸਬਸਟੈਂਸ ਯੂਜ਼ disorder ਜਿਹੜਾ ਉਹ ਕਰਦੇ ਆ
You know that the Punjabi American community in the SUTTER YUBA local community is significantly impacted by alcohol use disorder in themselves and or their loved ones.
ਵੀ alcohol use misuse abuse ਸੋ ਇਹ ਸਟੇਜਸ ਹੁੰਦੀਆਂ ਇੱਕ ਹਿਸਾਬ ਦੇ ਨਾਲ ਵੀ ਕਿੱਦਾਂ ਬੰਦਾ ਜਾਂਦਾ ਆ ਇੱਕ ਕੇਜ ਕਹਿੰਦੇ ਵੀ ਜਦੋਂ ਕੋਈ ਵੀ ਬੰਦਾ ਇਸ ਤੋਂ ਪੀੜਤ ਆ ਤਾਂ ਉਹਨੂੰ ਫਿਰ ਸਵਾਲ ਅਸੀਂ 4 ਸਵਾਲ ਪੁੱਛਦੇ ਆ ਉਹਦੀ ਸ਼ਾਰਟ ਫਾਰਮ ਉਹਨਾਂ ਨੇ ਰੱਖੀ ਆ ਕੇਜ CAGE ਜੇ 4 ਸਵਾਲਾਂ ਦੇ ਕੇਜ ਦੇ ਵਿੱਚ ਤੁਸੀਂ ਹੈਗੇ ਆ ਤਾਂ ਇਹਦਾ ਮਤਲਬ ਵੀ ਤੁਸੀਂ ਇਸ ਤੋਂ ਪੀੜਤ ਹੋ ਸਕਦੇ ਆ what are the things you see in these people which are common across?
So I think one of the most common things is they become dependent on it. So they can't continue life unless they're using alcohol or drugs. And people in alcohol detox need to seek medical care. They need to go to the hospital and seek emergency care because you can literally die from an alcohol detox.
Oh, really?
Yes. It's very, very dangerous.
ਵੀਕਲੀ ਜਾਂ ਜਿੱਦਾਂ ਵੀ ਤੁਸੀਂ ਉੱਥੇ ਮਿਲਦੇ ਆ ਆਪਣੀ ਗੱਲਬਾਤ ਜਿਹੜੀ ਉਹ ਕਰਦੇ ਆ 12 ਸਟੈਪ ਪ੍ਰੋਗਰਾਮ ਆ ਅਲਕੋਹਲ ਅਨੋਨਿਮਸ ਵਰਗੇ ਜਿਹੜੇ ਗਰੁੱਪ ਆ ਇਹਨਾਂ ਦੇ ਕਮਿਊਨਿਟੀ ਦੇ ਜਿਹੜੇ ਇਦਾਂ ਦੇ ਪ੍ਰੋਗਰਾਮ ਬਣੇ ਹੋਏ ਆ ਤਾਂ ਜੋ ਤੁਹਾਡਾ ਜਿਹੜਾ ਇਹ ਸ਼ਰਾਬ ਆ ਉਹ ਛਡਾਉਣ ਦੇ ਵਿੱਚ ਤੁਹਾਡੀ ਜਿਹੜੀ ਮਦਦ ਆ ਉਹ ਜਿਹੜੀ ਉਹ ਕਰਦੇ ਆ
Your risk of having an alcohol use disorder majority of the time is actually genetics.
Oh,
so
really?
It can run in your family, right?
But I totally agree because I'll talk for my own experience. I was addicted to methamphetamine.
Oh, wow.
And people told me that, hey, I had a problem. And I'm like, no, I don't have a problem. You have a problem with looking at me that way.
It's the people around that person who need to be more aware how they can help other than triggering them to start doing this all over again. So ਪੰਜਾਬੀ ਰੇਡੀਓ USA ਪੰਜਾਬੀ TV USA ਦੇ ਉੱਤੇ ਆਪ ਸਭ ਦਾ ਸਵਾਗਤ ਹੈ ਮੈਂ ਰਾਜਕਨਵੀਰ ਸਿੰਘ ਅੱਜ ਦੇ ਇਸ ਵਿਸ਼ੇਸ਼ ਪ੍ਰੋਗਰਾਮ ਦੇ ਵਿੱਚ ਅੱਜ ਆਪਾਂ ਗੱਲ ਕਰਾਂਗੇ ਸਟਰ ਯੂਬਾ ਕਾਉਂਟੀ ਦੇ ਪਬਲਿਕ ਹੈਲਥ ਆਫੀਸਰਸ ਉਹਨਾਂ ਦੇ ਨਾਲ ਸੰਬੰਧਿਤ ਜਿਹੜੇ ਬਿਹੇਵੀਅਰ ਜਿਹੜਾ ਡਿਪਾਰਟਮੈਂਟ ਆ ਉਹਨਾਂ ਦੇ ਨਾਲ ਪਿਛਲੀ ਵਾਰ ਜਦ ਆਪਾਂ ਇਹਨਾਂ ਦੇ ਨਾਲ ਗੱਲਬਾਤ ਕੀਤੀ ਸੀ ਤਾਂ ਆਪਾਂ ਸਬਸਟੈਂਸ ਯੂਜ਼ ਡਿਸਆਰਡਰ ਦੇ ਬਾਰੇ ਗੱਲਬਾਤ ਕੀਤੀ ਸੀ ਅੱਜ ਵੀ ਉਸੇ ਟੌਪਿਕ ਦੇ ਵਿੱਚ ਥੋੜਾ ਹੋਰ ਗਹਿਰਾਈ ਦੇ ਵਿੱਚ ਜਾਵਾਂਗੇ ਆਪਣੇ ਨਾਲ ਯੂਬਾ ਤੇ ਸਟਰ ਕਾਉਂਟੀ ਦੇ ਪਬਲਿਕ ਹੈਲਥ ਆਫੀਸਰ ਡਾਕਟਰ ਫੋਂਗ ਲੂ ਉਹ ਜੁੜ ਚੁੱਕੇ ਆ ਉਹਨਾਂ ਦੇ ਨਾਲ ਗੱਲ ਕਰਦੇ ਆ ਡਾਕਟਰ ਫੋਂਗ ਲੂ ਵੈਲਕਮ ਟੂ ਦ ਸ਼ੋ
Thank you.
ਐਂਡ ਉਸ ਦੇ ਨਾਲ ਆਪਣੇ ਨਾਲ ਰੌਬ ਗੀਅਰ ਉਹ ਵੀ ਜੁੜੇ ਹੋਏ ਨੇ ਇਹ ਵੀ ਲੰਮੇ ਸਮੇਂ ਤੋਂ ਇਸ ਕਾਉਂਟੀ ਦੇ ਇਸ ਡਿਪਾਰਟਮੈਂਟ ਦੇ ਨਾਲ ਕੰਮ ਕਰ ਰਹੇ ਆ ਮਿਸਟਰ ਰੌਬ ਵੈਲਕਮ ਟੂ ਦ ਸ਼ੋ
Thank you very much.
So, Dr. Luu, today we'll be talking about substance use disorder. Just to refresh our listeners' memory, just jog a little bit, just tell us a little bit about substance use disorder. What is that? What are the things we see if someone is suffering from that?
The substance use disorder is a very broad term that describes any substance you use, whether it be alcohol, marijuana, fentanyl, heroin, cocaine, meth, anything that you use and then it has an adverse effect for your life where you can't function, you can't go to work, it's affecting your social life too. So that then becomes a substance use disorder.
ਸੋ ਜਿੱਦਾਂ ਇਹ ਦੱਸ ਰਹੇ ਨੇ ਵੀ ਸਬਸਟੈਂਸ ਯੂਜ਼ ਡਿਸਆਰਡਰ ਇੱਕ ਇੱਦਾਂ ਦੀ ਚੀਜ਼ ਹੈ ਕਿ ਬ੍ਰੌਡਲੀ ਟਰਮ ਆ ਜਿਹਦੇ ਵਿੱਚ ਕਿਸੇ ਵੀ ਤਰੀਕੇ ਦਾ ਕੋਈ ਪਦਾਰਥ ਜਿਸ ਦੇ ਵਰਤਣ ਦੇ ਨਾਲ ਤੁਹਾਡੇ ਰੈਗੂਲਰ ਰੋਜ਼ਾਨਾ ਦੇ ਕੰਮਕਾਜ ਦੇ ਉੱਤੇ, ਤੁਹਾਡੀ ਜ਼ਿੰਦਗੀ ਦੇ ਉੱਤੇ, ਹਰ ਇੱਕ ਚੀਜ਼ ਦੇ ਉੱਤੇ ਜਿਹੜਾ ਅਸਰ ਪੈਂਦਾ ਆ, ਸੋ ਉਸ ਨੂੰ ਸਬਸਟੈਂਸ ਯੂਜ਼ ਡਿਸਆਰਡਰ ਜਿਹੜਾ ਉਹ ਕਰਦੇ ਆ। ਸੋ ਇਹ ਵੀ ਦੱਸਦਾ ਜਾਵਾਂ, ਡਾਕਟਰ ਲੂ ਪਿਛਲੇ 5 ਸਾਲ ਤੋਂ ਯੂਬਾ ਸਟਰ ਦੇ ਇਸ ਡਿਪਾਰਟਮੈਂਟ ਦੇ ਨਾਲ, ਇਸ ਕਾਊਂਟੀ ਦੇ ਨਾਲ ਕੰਮ ਕਰਦੇ ਆ ਰਹੇ ਆ। ਕਾਫੀ ਲੰਮਾ ਅਰਸਾ ਹੋ ਗਿਆ, ਸੋ ਇਹਨਾਂ ਨੇ ਕਾਫੀ ਚੀਜ਼ਾਂ ਜਿਹੜੀਆਂ ਇਸ ਦੇ ਵਿੱਚ ਦੇਖੀਆਂ। So Dr. Lou, as I was telling my listener, you've been working with the county for more than 5 years now. You've seen a lot of things change in the past 5 years. When we talk about substance use disorder, what are the changes you have seen, which is more prominent to you?
So more prominent is that people, because of the pandemic, because of really more stressful lives, we're seeing more substance uses, right? Because when we're stressed, we tend to reach for alcohol, we tend to reach for tobacco, even other stronger substances. So my colleague here, Robert, can talk even more about it because he sees this on a day-to-day basis, working at SUTTER YUBA Behavioral Health. In particular, this time, I really want to focus on alcohol use disorder. And the reason being is most recently in April is Alcohol Use Awareness Month. And we do know that the Punjabi American community in the SUTTER YUBA local community is significantly impacted by alcohol use disorder in themselves and or their loved ones.
ਸੋ ਜਿੱਦਾਂ ਡਾਕਟਰ ਲੂ ਇਸ ਦੇ ਵਿੱਚ ਦੱਸ ਰਹੇ ਆ ਵੀ ਕੀ ਜਿਹੜੀ ਕਾਰਨ ਆਪਾਂ ਦੇਖਿਆ ਵੀ ਪਿਛਲੇ 5 ਸਾਲਾਂ 'ਚ ਚੀਜ਼ ਵਧੀਆ, ਉਹਨੂੰ ਦੱਸ ਵੀ ਪੈਂਡੈਮਿਕ ਦੇ ਨਾਲ ਸਟ੍ਰੈਸ ਆ, ਜਦੋਂ ਸਟ੍ਰੈਸ ਹੁੰਦਾ ਲੋਕ ਵੱਖ-ਵੱਖ ਸਬਸਟੈਂਸਿਸ, ਵੱਖ-ਵੱਖ ਨਸ਼ਿਆਂ ਦੇ ਵੱਲ ਨੂੰ ਜਿਹੜਾ ਉਹ ਜਾਂਦੇ ਆ। ਬਿਹੇਵੀਅਰਲ ਹੈਲਥ ਦੇ ਨਾਲ ਮਿਸਟਰ ਰੋਬਰਟ ਗੀਰ ਜਿਹੜੇ ਉਹ ਕੰਮ ਕਰਦੇ, ਉਹ ਆਪਾਂ ਨੂੰ ਹੋਰ ਇਸ ਦੇ ਵਿੱਚ ਦੱਸਣਗੇ। ਤੇ ਅੱਜ ਕਹਿੰਦੇ ਵੀ ਆਪਾਂ ਜਿਹੜਾ ਉਹ ਜ਼ਿਆਦਾ ਅਲਕੋਹਲ ਯੂਜ਼ ਡਿਸਆਰਡਰ ਆ ਉਸ ਦੇ ਬਾਰੇ ਗੱਲ ਕਰਾਂਗੇ। ਆਪਣੀ ਜਿਹੜੀ ਖਾਸ ਕਰਕੇ ਪੰਜਾਬੀ ਕਮਿਊਨਿਟੀ ਆ ਉਹ ਇਸ ਤੋਂ ਸਫਰ ਕਰਦੀ ਆ। ਇਹ ਚਲੋ ਇਹ ਸਟਰ ਤੇ ਯੂਬਾ ਕਾਊਂਟੀ ਦੇ ਨਾਲ ਆ, ਪਰ ਇਹ ਹਰ ਇੱਕ ਜਗ੍ਹਾ ਦੇ ਉੱਤੇ ਪ੍ਰੋਬਲਮ ਆ। ਆਪਾਂ ਇਹਨਾਂ ਤੋਂ ਸਿੱਖਣ ਦੀ ਕੋਸ਼ਿਸ਼ ਕਰਾਂਗੇ ਇਸ ਨੂੰ ਕਿੱਦਾਂ ਨਜਿੱਠਿਆ ਜਾ ਸਕਦਾ ਹੈ। ਕਮਿੰਗ ਟੂ ਯੂ ਮਿਸਟਰ ਰੋਬ ਗੀਅਰ, tell us a little bit about yourself, how long you've been working with the county and in this department.
So I've been with the county about 3.5 years. I've been a certified drug and alcohol counselor for 20 years.
Okay. So Rob, as Dr. Lou was mentioning, you see these people suffering from this disorder on daily basis. What are the first things you see which strike to you?
I think the biggest thing that we see is people coming in with a loss of hope. A loss of, self-awareness, no self-esteem. They're at some of the lowest points in their life than they've ever been.
So when people come to you suffering from these disorders, as you mentioned, loss of hope, loss of confidence, self-esteem, how is that? You've been doing this, as you said, more than 20 years. You are a counselor for that. What are your first instinct to talk to them? What are your first words to them? How do you start talking to them? Because they're kind of, as you mentioned, low self-esteem. They don't talk much. They don't want to say that they're suffering from it. What are your first words, contact with them?
One of the first words is, I'm in recovery myself. And I let people know that I've been where you're at. I know how you're feeling. Because when you can let somebody know that you've been in the same spot that they have, there's a connection that's there. That, it's not what they say, it's how they look. And you know what's going on with them. So I think the first thing is myself and my staff here, we all let them know that we've been in the same place, that we understand what they're going through, that it took a lot of courage to walk into our building and say, hey, I need to be considered because I have a problem.
So coming back to you, Dr. Lou. So uh, when we talk about alcohol use disorder, what kind of numbers do you have as a county? How many people are suffering from this kind of disorder? Uh, let's start with that. Then we slowly go into deep dive into it. What are the symptoms? What to look for? So, what's the latest numbers on this disorder?
So I don't actually have specific of alcohol use disorder numbers
Hmm.
because it's actually harder to quantify than you think.
Okay.
And most of it is from based on self-report. But let's go with the description, right?
Okay.
So I drink alcohol too, right?
Hmm.
So it doesn't mean that when someone drink alcohol, then you immediately jump to having an alcohol use disorder. It's along a continuum. So alcohol use, misuse, abuse, essentially, is the continuum. And a disorder is defined for alcohol use when it actually adversely affect your life. You are not going to work. You have trouble in your social life. There's 4 very simple questions that we usually ask you to kind of prompt you to have that self-awareness of, is alcohol use causing an issue in your life? So the acronym is CAGE. Do you feel that you should cut down on your alcohol use? Are you concerned when someone criticize you? So if someone bring up criticism of alcohol use, you are annoyed. So that's the A in the cage, right? Do you feel guilty about your alcohol use? Do you regret drinking alcohol often? And then the E stands for eye opener. So do you wake up already clamoring, wanting to drink alcohol, right? So that's when we go into alcohol use disorder. And as you can tell, it depends for every person. Like maybe my answer to that is after only 2 drinks every day, but your answer is 5.
ਸੋ ਡਾਕਟਰ ਲੂ ਜਿੱਦਾਂ ਦੱਸ ਰਹੇ ਆਪਾਂ ਨੂੰ ਵੀ ਅਲਕੋਹਲ ਯੂਜ਼ ਮਿਸਯੂਜ਼ ਅਬਿਊਜ਼ ਸੋ ਇਹ ਸਟੇਜਸ ਹੁੰਦੀਆਂ ਇੱਕ ਹਿਸਾਬ ਦੇ ਨਾਲ ਵੀ ਕਿੱਦਾਂ ਬੰਦਾ ਜਾਂਦਾ ਆ ਇੱਕ ਕੇਜ ਕਹਿੰਦੇ ਵੀ ਜਦੋਂ ਕੋਈ ਵੀ ਬੰਦਾ ਇਸ ਤੋਂ ਪੀੜਤਾ ਤਾਂ ਉਹਨੂੰ ਫਿਰ ਸਵਾਲ ਅਸੀਂ 4 ਸਵਾਲ ਪੁੱਛਦੇ ਆ ਉਹਦੀ ਸ਼ਾਰਟ ਫਾਰਮ ਉਹਨਾਂ ਨੇ ਰੱਖੀ ਆ ਕੇਜ CAGE ਵੀ ਪਹਿਲਾ ਸਵਾਲ ਇਹ ਹੁੰਦਾ ਵੀ ਕੀ ਤੁਹਾਨੂੰ ਲੱਗਦਾ ਵੀ ਤੁਹਾਨੂੰ ਘਟਾਉਣੀ ਚਾਹੀਦੀ ਆ ਕੱਟ ਡਾਊਨ ਕਰਨੀ ਚਾਹੀਦੀ ਆ ਜੇ ਤੁਹਾਡਾ ਇਸ ਦੇ ਵਿੱਚ ਹਾਂ ਆ ਕਿ ਜੇ ਤੁਹਾਨੂੰ ਕੋਈ ਕ੍ਰਿਟਿਸਾਈਜ਼ ਕਰਦਾ ਆ ਜੇ ਤੁਹਾਨੂੰ ਕਹਿੰਦਾ ਵੀ ਨਾ ਤੂੰ ਨਾ ਪੀਆ ਕਰ ਤੁਸੀਂ ਅਨੋਏ ਹੋ ਜਾਂਦੇ ਆ ਇਰੀਟੇਟਡ ਹੋ ਜਾਂਦੇ ਆ ਤੁਹਾਨੂੰ ਸਵਾਦ ਉਹ ਚੰਗਾ ਨਹੀਂ ਲੱਗਦਾ ਇਹ ਕੇਜ ਦੇ ਵਿੱਚ ਇਹ ਆ ਜਾਂਦਾ ਜੀ ਤੋਂ ਆ ਵੀ ਗਿਲਟੀ ਵੀ ਤੁਹਾਨੂੰ ਆਪਣੇ ਆਪ ਨੂੰ ਵੀ ਪਛਤਾਵਾ ਵੀ ਹੁੰਦਾ ਮਹਿਸੂਸ ਕਰਦੇ ਆ ਵੀ ਆਹ ਚੀਜ਼ ਮੈਂ ਗਲਤ ਕਰ ਰਿਹਾ ਆ ਤੇ ਈ ਦੇ ਵਿੱਚ ਹੁੰਦਾ ਆਈ ਓਪਨਰ ਵੀ ਅੱਖਾਂ ਜਿਹੜੀਆਂ ਇੱਕ ਹਿਸਾਬ ਦੇ ਨਾਲ ਖੋਲਦੀਆਂ ਵੀ ਹਾਂ ਵੀ ਇਹ ਸਿਚੁਏਸ਼ਨ ਚੱਲ ਰਹੀ ਹੈ ਸੋ ਕਹਿੰਦੇ ਵੀ ਜੇ 4 ਸਵਾਲਾਂ ਦੇ ਕੇਜ ਦੇ ਵਿੱਚ ਤੁਸੀਂ ਹੈਗੇ ਆ ਤਾਂ ਇਹਦਾ ਮਤਲਬ ਵੀ ਤੁਸੀਂ ਇਸ ਤੋਂ ਪੀੜਤ ਹੋ ਸਕਦੇ ਆ ਸੋ ਦੈਟ ਲਿਟਰਲੀ ਮੀਨਸ ਯੂ ਆਰ ਇਨ ਦ ਕੇਜ ਆਫ ਅਲਕੋਹਲ so basically alcohol has put a cage around you you can't basically survive without it, it's kind of hard for people to be in that position.
Yeah, so alcohol as a toxic substance can actually alter your brain function, right? So that's why when we say that alcohol use disorder is a lifelong issue, a chronic medical issue, just like diabetes, just like having high blood pressure. It doesn't mean that it's insurmountable. There are very well-studied treatment for it. A handful of medications that we can talk about. There's also talk therapy, counseling, so you can identify like what triggers you to want to drink, right? There's also, you've heard of Alcoholics Anonymous. I actually just found online a South Asian Alcoholics Anonymous remote, so it's geared towards the Punjabi American community. But we really want to emphasize that the reason why it's so challenging for you if you have an alcohol use disorder to quit cold turkey is that you can't. Your brain has been altered. So you need assistance you need to go to Rob. You need to know of all the available options. And it depends on how severe your situation is, your individual situation. That's when, Rob, you can talk about the continuum of services available, right?
Okay. So Rob, you pitching over here right now when Dr. Luu is saying that it alters your brain function. It's a chronic, basically, disorder. Uh, what are the things you see in these people which are common across?
So I think one of the most common things is they become dependent on it. So they can't continue life unless they're using alcohol or drugs. So they keep using more and more, right? And as you become more dependent on things, your life falls apart around you because the main priority in life is either drinking or using drugs. That becomes a life sustaining thing for you because if you just quit alcohol, you go into a detox that's extremely dangerous. And people in alcohol detox need to seek medical care. They need to go to the hospital and seek emergency care because you
Okay.
can literally die from an alcohol detox.
Oh, really?
Yes.
Yes. It's very, very dangerous. So you do not want to quit cold turkey. You need to be talking to your doctor. You need to be going into your local programs to seek care because we have seen. Unfortunately, I've seen myself people who try to do that and pass away. So there's chemicals in your body that goes up and down based on you going cold turkey. Potassium, magnesium, all those things, and those can be life-threatening.
So you basically body becomes dependent on alcohol to such an extent that you can't survive that.
Yeah, so what you want to do is you want to work
Replace
with
that.
someone, replace it with medication, so then and then make sure also the vitamins and the other chemicals are stable before you completely is deemed safe from the alcohol.
ਸੋ ਆਪਣੇ ਜਿਹੜੇ ਸਰੋਤਿਆਂ ਨੂੰ ਮੈਂ ਦੱਸਦਾ ਜਾਵਾਂ ਜਿੱਦਾਂ ਡਾਕਟਰ ਲੂ ਤੇ ਰੌਬ ਨੇ ਜਿੱਦਾਂ ਉਹ ਦੱਸਿਆ ਵੀ ਸ਼ਰਾਬ ਇੱਕ ਬਹੁਤ ਭੈੜਾ ਜਿਹੜਾ ਉਹ ਅਸਰ ਪਾਉਂਦੀ ਆ ਤੁਹਾਡੇ ਕੰਮ ਦੇ ਉੱਤੇ ਵੀ, ਤੁਹਾਡੇ ਸੋਸ਼ਲ ਸਮਾਜਿਕ ਜਿਹੜੇ ਉਹ ਜੀਵਨ ਦੇ ਉੱਤੇ ਵੀ, ਉਹ ਸਾਰੀਆਂ ਚੀਜ਼ਾਂ ਦੇ ਉੱਤੇ ਬਹੁਤ ਭੈੜਾ ਜਿਹੜਾ ਉਹ ਅਸਰ ਪਾਉਂਦੀ ਆ। ਪਰ ਕਹਿੰਦੇ ਵੀ ਜਿਹੜੀ ਛੱਡਣੀ ਆ ਉਹਦੇ ਲਈ ਔਖਿਆਈ ਤਾਂ ਜਿਹੜੀ ਉਹ ਆਉਂਦੀ ਆ, ਪਰ ਕੀਤਾ ਜਾ ਸਕਦਾ। ਕਈ ਤਰੀਕੇ ਦੇ ਪ੍ਰੋਗਰਾਮ ਆ। ਕਹਿੰਦੇ ਵੀ ਅਚਨਚੇਤੇ ਨਹੀਂ ਵੀ ਜੇ ਤੁਸੀਂ ਬਹੁਤ ਜ਼ਿਆਦਾ ਸ਼ਰਾਬ ਪੀਂਦੇ ਤੇ ਵੀ ਅਗਲੇ ਦਿਨ ਹੀ ਜਿੱਦਾਂ ਕਹੋ ਵੀ ਤੁਸੀਂ ਜਿਹੜੀ ਉਹ ਛੱਡ ਦੇਣੀ ਆ, ਏਦਾਂ ਨਹੀਂ। ਕਹਿੰਦੇ ਵੀ ਉਹਦੇ ਨਾਲ ਵੀ ਕਈ ਜਿਹੜੀ ਦਿੱਕਤ ਆ ਜਾਂਦੀ ਆ ਕਿਉਂਕਿ ਸਰੀਰ ਤੁਹਾਡਾ ਉਹਦੇ ਤੇ ਇੰਨਾ ਜ਼ਿਆਦਾ ਡਿਪੈਂਡੈਂਟ ਹੋ ਜਾਂਦਾ ਹੈ ਵੀ ਜੇ ਤੁਸੀਂ ਡੀਟੌਕਸ ਦੇ ਵਿੱਚ ਜਦੋਂ ਤੁਸੀਂ ਜਾਂਦੇ ਆ ਇਹਨੂੰ ਛੱਡਦੇ ਹੋਏ ਤਾਂ ਤੁਸੀਂ ਪਾਸ ਵੀ ਕਰ ਸਕਦੇ ਆ, ਤੁਹਾਡੀ ਮੌਤ ਵੀ ਜਿਹੜੀ ਹੋ ਸਕਦੀ ਆ। ਉਹਦੇ ਨਾਲ ਕਹਿੰਦੇ ਵੀ ਜਦੋਂ ਤੁਸੀਂ ਇਹ ਛੱਡ ਰਹੇ ਆ ਤਾਂ ਤੁਹਾਨੂੰ ਜ਼ਰੂਰ ਜਿਹੜੀ ਕੇਅਰ ਦੀ ਮੈਡੀਕਲ ਕੇਅਰ ਜਿਹੜੀ ਆ ਉਹ ਤੁਹਾਨੂੰ ਜ਼ਰੂਰ ਲੈਣੀ ਚਾਹੀਦੀ ਆ, ਸਹਾਇਤਾ ਜਿਹੜੀ ਉਹ ਲੈਣੀ ਚਾਹੀਦੀ ਆ। ਰੌਬ ਵਰਗੇ ਬੰਦਿਆਂ ਦੇ ਨਾਲ ਗੱਲ ਕਰਨੀ ਚਾਹੀਦੀ ਆ, ਕਾਉਂਸਲਿੰਗ ਲੈਣੀ ਚਾਹੀਦੀ ਆ ਤੇ ਦਵਾਈਆਂ ਜਿਹੜੀਆਂ ਲੈਣੀਆਂ ਚਾਹੀਦੀਆਂ ਤਾਂ ਜੋ ਤੁਹਾਡੀ ਬਾਡੀ ਫੰਕਸ਼ਨਿੰਗ ਪਹਿਲਾਂ ਸਟੇਬਲ ਹੋਵੇ, ਫਿਰ ਉਸ ਤੋਂ ਬਾਅਦ ਦੇ ਵਿੱਚ ਆਪਾਂ ਇਸ ਨੂੰ ਹੌਲੀ ਹੌਲੀ ਜਿਹੜਾ ਇਹ ਛੱਡਣਾ ਹੈਗਾ ਆ। So Rob, what are the options available for people who are suffering from alcohol abuse or a use disorder? What are the options available in your county if somebody is suffering from disorder they can seek?
So if someone can come in, the first thing we do is we sit down with them and sometimes their families. We do a triage. We take a look at their history and really where they're at, right? And if a detox is needed, we do contract with residential treatment facilities that have medical detox programs.
Okay.
So they have medical people on site, they have a doctor that comes in, and they medically detox the person.
Okay.
And once they're through that detox portion, which is generally 6 to 10 days, something like that, we keep them in the residential facility so they can learn to cope with their feelings, work through things, take a look at maybe what's the driving force behind them drinking and not being able to stop. So we found that if we could keep somebody there for at least 30 days, that their chances of when they get out, then they begin our outpatient program here at YUBA SUTTER Behavioral Health. And they participate in outpatient program for up to 6 months, sometimes a year, coming during the day or in the evening, depending on their schedule. That gives them, the abilities to learn to cope, learn to live with things. So we go from triage to residential to outpatient. And during that point of time, we ask people to either participate in a 12-step program. There are church-based programs. There are a multitude of things. For the Punjabi community, there are online Zoom meetings in both Narcotics Anonymous and Alcoholics Anonymous that they can participate in. That, if someone's not comfortable walking into a community meeting of those sorts, they can do it through that way. And we help them. We have translators on site so that we can translate if we need, to make people feel welcome and the ability to change their lives.
ਸੋ ਰੌਬ ਜਿੱਦਾਂ ਦੱਸ ਰਹੇ ਆ ਵੀ ਯੂਬਾ ਸੈਟਰ ਦੇ ਵਿੱਚ ਬਹੁਤ ਸਾਰੇ ਜਿਹੜੇ ਪ੍ਰੋਗਰਾਮਸ ਅਵੇਲੇਬਲ ਆ ਜੇ ਤੁਸੀਂ ਅਲਕੋਹਲ ਜਿਹੜਾ ਬੇਸਿਕਲੀ ਅਲਕੋਹਲ ਅਬਿਊਜ਼ ਡਿਸਆਰਡਰ ਤੋਂ ਪੀੜਤ ਆ ਪਹਿਲਾਂ ਪਰਿਵਾਰ ਦੇ ਨਾਲ ਤੇ ਤੁਹਾਡੇ ਨਾਲ ਗੱਲ ਕਰਦੇ ਟਰਾਈਏਜ ਜਿਹੜੀ ਉਹ ਕਰਦੇ ਆ ਉਸ ਤੋਂ ਬਾਅਦ ਇੱਕ ਰੈਜ਼ੀਡੈਂਸ਼ੀਅਲ ਇਹਨਾਂ ਦਾ ਪ੍ਰੋਗਰਾਮ ਆ ਜਿੱਥੇ ਮੈਡੀਕਲੀ ਡੀਟੌਕਸ ਕਰਨ ਦੇ ਵਿੱਚ ਤੁਹਾਡੀ ਮਦਦ ਕੀਤੀ ਜਾਂਦੀ ਆ 6 ਤੋਂ 10 ਦਿਨ ਉਸ 'ਚ ਲੱਗਦੇ ਆ ਫਿਰ ਰੈਜ਼ੀਡੈਂਸ਼ੀਅਲ ਇੱਕ ਫੈਸਿਲਿਟੀ ਦੇ ਵਿੱਚ ਰਹਿੰਦੇ ਆ ਜਿੱਥੇ ਤੁਹਾਨੂੰ ਆਪਣੀਆਂ ਫੀਲਿੰਗਸ ਦੇ ਨਾਲ ਗੱਲਬਾਤ ਕੀਤੀ ਜਾਂਦੀ ਆ ਕਾਉਂਸਲਿੰਗ ਹੁੰਦੀ ਆ ਉਹ ਸਾਰਾ ਕੁਝ ਹੁੰਦਾ ਮਹੀਨਾ ਜਿਹੜਾ ਉਸ ਦੇ ਵਿੱਚ ਲੱਗਦਾ ਆ ਤੇ ਫਿਰ ਇਵੈਂਚੁਅਲੀ ਇੱਕ ਆਊਟ ਪੇਸ਼ੈਂਟ ਪ੍ਰੋਗਰਾਮ ਜਿਹੜਾ ਇਹਨਾਂ ਦਾ ਉਹ ਬਣਦਾ ਆ ਜਿਸ ਦੇ ਵਿੱਚ ਤੁਸੀਂ ਰੈਗੂਲਰਲੀ ਉੱਥੇ ਉਹਨਾਂ ਦੇ ਨਾਲ ਵੀਕਲੀ ਜਾਂ ਜਿੱਦਾਂ ਵੀ ਤੁਸੀਂ ਉੱਥੇ ਮਿਲਦੇ ਆ ਆਪਣੀ ਗੱਲਬਾਤ ਜਿਹੜੀ ਉਹ ਕਰਦੇ ਆ 12 ਸਟੈਪ ਪ੍ਰੋਗਰਾਮ ਆ ਅਲਕੋਹਲ ਅਨੋਨਿਮਸ ਵਰਗੇ ਜਿਹੜੇ ਗਰੁੱਪ ਆ ਇਹਨਾਂ ਦੇ ਕਮਿਊਨਿਟੀ ਦੇ ਜਿਹੜੇ ਇਦਾਂ ਦੇ ਪ੍ਰੋਗਰਾਮ ਬਣੇ ਹੋਏ ਆ ਤਾਂ ਜੋ ਤੁਹਾਡਾ ਜਿਹੜਾ ਇਹ ਸ਼ਰਾਬ ਆ ਉਹ ਛਡਾਉਣ ਦੇ ਵਿੱਚ ਤੁਹਾਡੀ ਜਿਹੜੀ ਮਦਦ ਆ ਉਹ ਜਿਹੜੀ ਉਹ ਕਰਦੇ ਆ Dr. Luu, you were mentioning before like triggers, like what are the common point of triggers, or this varies according to individual, like are there some common triggers as well?
Yeah, well, most of the time it's going to be really stressful events too, right? So death of a family member, divorce, financial hardship. And I would be remiss if I don't mention that your risk of having an alcohol use disorder, the majority of the time is actually genetics.
Oh, really?
It can run in your family, right? So if you notice that your father, your grandfather has it, you have a higher risk. That doesn't mean that you definitely will have it, but you have an increased risk. Just like with diabetes, right? Just like with diabetes, if it runs in your family, if your doctor asks about family history, they really should also be paying attention about your family history of alcohol use disorder. So when you know that about your family history, when you know what are your potential triggers, one is do talk therapy, do counseling, so then they can give you the skills so that you manage it without medication, right? And then go to those Alcoholics Anonymous, go to those, even if it's on Zoom because you don't want to come in, so then you have a sense of community with other people who know where you're coming from. And then if that rises to the level where you're like, okay, I think I need medication in addition to talk therapy and group therapy, then there's 3 medications that are currently approved by the FDA to manage alcohol use disorder. So that kind of depends, but one of them is called anti-abuse, where basically if you take it every day and you try to drink alcohol, you're going to feel very, very ill because it basically just makes you not want to
drink it.
Yeah, that's why it's called anti-abuse. There's another one, camprosate. It's a pill, but you have to take it 3 times a day. It's a little bit more challenging because of the frequency. And then there's a medication that's actually an injectable, and that is called Vivitrol, and that is really helpful because not only can it treat for those who have alcohol use disorder, but also those who have opioid use disorder. So, and this has to be managed by a doctor. But if you happen to have both dependency on, say, fentanyl and dependency on alcohol, they can consider the Vivitrol injection.
ਸੋ ਜਿੱਦਾਂ ਡਾਕਟਰ ਲੂ ਜਿਹੜੇ ਉਹ ਦੱਸ ਰਹੇ ਆ ਵੀ ਥੈਰੇਪੀ ਕਾਉਂਸਲਿੰਗ ਕਈ ਵਾਰੀ ਜ਼ੂਮ ਦੇ ਉੱਤੇ ਵੀ ਤੁਸੀਂ ਇਸ ਦੇ ਲਈ ਮਦਦ ਜਿਹੜੀ ਉਹ ਲੈ ਸਕਦੇ ਆ 3 ਮੈਡੀਕੇਸ਼ਨਸ ਉਹ ਕਹਿੰਦੇ ਵੀ ਆਲਰੇਡੀ ਅਪਰੂਵਡ ਆ ਉਹਨਾਂ ਨੇ ਜਿੱਦਾਂ ਹੁਣ ਦੱਸਿਆ ਵੀ ਇੱਕ ਗੋਲੀ ਆ ਇੱਕ ਗੋਲੀ ਜਿਹੜੀ ਉਹ 3 ਵਾਰੀ ਲੈਣੀ ਆ ਇੱਕ ਇੰਜੈਕਟੇਬਲ ਆ ਉਹ ਕੱਲਾ ਅਲਕੋਹਲ ਲਈ ਨਹੀਂ ਓਪੀਓਇਡ ਦੇ ਡਿਸਆਰਡਰ ਲਈ ਵੀ ਜਿਹੜੀ ਉਹ ਮਦਦ ਜਿਹੜੀ ਇਸ ਦੇ ਵਿੱਚ ਕਰਦੀ ਆ so these therapy session counseling sessions are they available through county programs is this available to all or is this something recommended by your insurance?
Go ahead, Rob.
Okay, so if a person is on Medi-Cal, they can come into our facility. Their Medi-Cal will pay for substance abuse treatment, mental health treatment, all of that. If say they have private insurance, every private insurance has a portion of that will treat substance abuse. So it really doesn't matter where it is, they can get treatment for it. It just depends on, the difference of with Medi-Cal, we can do outpatient residential detox and all that's covered under the Medi-Cal. So there's an answer no matter what kind of insurance somebody has.
ਓਕੇ ਸੋ ਤੁਹਾਡੇ ਕੋਲ ਕਿਸੇ ਵੀ ਤਰੀਕੇ ਦੀ ਇੰਸ਼ੋਰੈਂਸ ਆ ਤਾਂ ਇਹ ਉਹਦੇ ਨਾਲ ਵਰਕ ਕਰ ਸਕਦੇ ਆ ਮੈਡੀਕਲ ਵਾਲਿਆਂ ਦੇ ਲਈ ਵੀ ਆ ਈਵਨ ਤੁਹਾਡੇ ਕੋਲ ਪ੍ਰਾਈਵੇਟ ਇੰਸ਼ੋਰੈਂਸ ਵੀ ਆ ਤਾਂ ਉਹਦੇ ਵਿੱਚ ਸਬਸਟੈਂਸ ਡਿਸਆਰਡਰ ਦੇ ਲਈ ਇਹ ਜਿਹੜੇ ਪ੍ਰੋਗਰਾਮਸ ਦੇ ਲਈ ਕੁਛ ਨਾ ਕੁਛ ਅਵੇਲੇਬਲ ਮਦਦ ਅਵੇਲੇਬਲ ਜਿਹੜੀ ਉਹ ਹੈਗੀ ਆ ਸੋ ਜੇ ਤੁਸੀਂ ਜਾਂ ਤੁਹਾਡਾ ਕੋਈ ਪਿਆਰਾ ਇਸ ਤੋਂ ਪੀੜਤ ਆ ਤਾਂ ਤੁਸੀਂ ਜ਼ਰੂਰ ਇਸ ਮਦਦ ਲੈਣ ਦੇ ਲਈ ਗੱਲ ਕਰੋ ਡਾਕਟਰ ਲੂ I think the most I would say the difficult part is somebody recognizing themselves that I have this disorder. That's kind of the first step to get into there. How can somebody reach there? How does a family help somebody to reach to that point?
So we're both smiling because we both experienced this. Me as a doctor talking to patients, and Rob as a counselor talking to patients too. So I'm going to start, but I also would love it for Rob to chime in. So I think the key thing is using like that CAGE set of questions, right? And if you Google CAGE alcohol questionnaire, it kind of pops up. And then I would recommend you do it with your loved one that you're concerned about, right? So it's not that you are telling them they have an issue. It's that's like, no, this is a tool, a calculator, and it tells you essentially if you have an issue. Right. So it's very much objective assessment and not like, well, you just think I have a problem. I don't think I have a problem. I'm okay. So that would be my recommendation is to use a very short CAGE questionnaire tool online. Rob?
Okay. Yes, Rob. Yeah.
So I totally agree because I'll talk for my own experience. I was addicted to methamphetamine.
Oh, wow.
And people told me that, hey, I had a problem. And I'm like, no, I don't have a problem. You have a problem with looking at me that way. So I was one of the last people to realize that I had a problem. So when I put myself in treatment, when I did things, people pushed me there. But until I really realized it myself, and that's the good thing about a treatment program or outpatient, is you become introspective of looking into inside you and seeing what the world has happened around you, how things have fallen apart, how your family's pushed you away. And when you can start realizing those things, then you see what everybody else is telling you. But what we find is the majority of people walk into our building, not necessarily because they want to, but it's because their family or the courts or somebody has pushed them this way. Our goal in treatment is to get people to realize on their own that
Mm.
yes, they have a problem, and then they can start the change process. Once I realize something, then I can begin to change that.
Mm. Yeah, this is really, I think, the important part there. Help is available if only somebody wants that help. Like to get them through that door is the most difficult part. And I'm glad we are talking about these things, and hopefully, our listeners, our viewers can
Mhm.
talk to their family, their loved ones who are suffering, who they feel like they're suffering from this disorder, that they need help, because this has really hurt our family, our community in many ways. Dr. Lou, you've seen, you go to parties, you socialize, right? You see this all around you. It's hard to miss, how somebody who's already suffering from this, uh, how can, should they not go there altogether? How a family or loved ones can encircle them, like how's that they treat themselves through this.
Okay. As usual, I'm gonna start, but I love for Rob to chime in because he has lived experience. Is that it's gonna again depends. So you can't stop going to family event. You can't stop going to social events. But through talk therapy, through counseling, and group therapy, you learn the skills to approach these social interactions. And whether is that you hold a can of 0% alcohol, or you hold a can of sparkling water. So
Hmm.
then if people offer you something, you're like, I'm good. I have this other drink in my hand. Thank you very much. Or another thing is you have a partner, and that person kind of helps you to be accountable. And then finally, if you need some medication, one of those three medication, you can use it what we call as needed. So you don't have to use it every day, but with the supervision and prescription of a doctor, you can only use it for the holidays. Right.
Hmm.
So say when, a big holiday comes around, big festival comes around, like the Sikh parade is here in the beginning of November, and you're like, okay, it's going to be a lot of celebration. I'm going to be under a lot of stress. I'm going to see a lot of family members visiting from all over. That's when you can talk to your therapist, your doctor, and saying like, I know it's coming. It happens every year. How can you help me prepare for these stressors?
Yes, Rob, add on
I
to
think
this.
in most cases, families are super supportive of what their loved ones are doing.
Hmm.
So hopefully, the loved one has been open that they're in recovery, they're trying to change their lives, they're trying to do something different, so that other members of the family kind of encompass around them, form a cocoon, so to speak, so that, there's probably other family members that maybe don't look at it the same way.
Hmm.
So it's a protection thing where you've got the accountability partner.
You need some bodyguards there.
You're 100% correct. And with that, you can have success. So,
Yeah. Uh, Rob, coming back to you, as you were mentioning, you were addicted before. When did you realize yourself, other than the family, that this is why, or I need to change now?
it was a long process actually,
How long does it
because,
took you?
it took me probably 15 years
Wow.
before I really realized that. And I tried to stop over a period of 5 to 6 years, that I would
Hmm.
get some clean time and then I would use again and clean time. And finally, it took one day of going, that's it, I'm done. I
Hmm.
just, it wasn't the worst bottom we speak of that I ever had, but it was just a point in time with my life that I knew if I didn't stop, it was going to be, jails, institutions, or death. The
Hmm.
three of those. For me, I got involved in a 12-step program. I started doing things. I only hung around with people that were doing what I was doing. And it's a long process. I've got about 20 and a half years, clean and sober. And it's still a process every day that I'm still involved in a 12-step program. I have a sponsor. I have friends that are involved in that. So it's a daily process for me. And I have to always remember that, there's stress, loved ones pass away. There's all those things that you have to watch because, as Dr. Lou said, those are all triggers. And anybody can get triggered. So you have to continually work at that. I'm personally proud of the recovery I've got. It hasn't been easy, but I have a life beyond my wildest dream because of my recovery.
Well, see, you recovered from there, and now you're helping other people. That's that's what it's all about. And thank you for sharing your story with us. And hopefully, a lot of people see that and see that okay, it's just not that I'm suffering. I can help as well once I recover. So thank you for that story, for sharing that story. ਸੋ ਜਿੱਦਾਂ ਜਿੱਦਾਂ ਡਾਕਟਰ ਲੂ ਤੇ ਰੌਬ ਨੇ ਜਿਹੜਾ ਉਹ ਦੱਸਿਆ ਕਈ ਚੀਜ਼ਾਂ ਜਿਹੜੀਆਂ ਉਹਨਾਂ ਨੇ ਦੱਸੀਆਂ ਟ੍ਰਿਗਰ ਤੁਹਾਡਾ ਕਿਸੇ ਵੀ ਚੀਜ਼ ਤੋਂ ਜਿਹੜਾ ਉਹ ਹੋ ਸਕਦਾ ਹੈ ਤੁਹਾਨੂੰ ਕਿਸੇ ਦੀ ਗੱਲ ਤੋਂ ਕਿਸੇ ਦੇ ਡਿਵੋਰਸ ਆਪਣੇ ਡਿਵੋਰਸ ਤੋਂ ਕੋਈ ਪਰਿਵਾਰ ਦੇ ਵਿੱਚ ਜੀ ਚਲਿਆ ਜਾਂਦਾ ਆ ਇਹ ਚੀਜ਼ਾਂ ਕਰਕੇ ਤੁਹਾਡਾ ਕਈ ਵਾਰੀ ਜੀ ਕਰਦਾ ਵੀ ਆਪਾਂ ਫਿਰ ਇਸ ਪਾਸੇ ਵੱਲ ਨੂੰ ਜਿਹੜਾ ਉਹ ਜਾਈਏ ਰੌਬ ਖੁਦ ਮੈਥ ਦੇ ਐਡਿਕਟ ਸੀਗੇ ਪਰ ਉਹਨਾਂ ਦੇ ਪਰਿਵਾਰ ਨੇ ਵੀ ਉਹਨਾਂ ਨੂੰ ਧੱਕਿਆ ਪਰ ਕਹਿੰਦੇ ਜਿੰਨੀ ਦੇਰ ਤੱਕ ਉਹਨਾਂ ਦੇ ਅੰਦਰੋਂ ਆਵਾਜ਼ ਨਹੀਂ ਆਈ ਉਨੀ ਦੇਰ ਤੱਕ ਉਹ ਛੱਡ ਨਹੀਂ ਸਕੇ ਛੱਡ ਦਿੰਦੇ ਸੀ ਕਰ ਲੈਂਦੇ ਸੀ ਛੱਡ ਦਿੰਦੇ ਸੀ ਕਰ ਲੈਂਦੇ ਸੀ ਪਰ ਇਵੈਂਚੁਅਲੀ ਉਹਨਾਂ ਨੇ ਦੇਖਿਆ ਵੀ ਫਿਰ ਇਸ ਤੋਂ ਬਾਅਦ ਦੇ ਵਿੱਚ ਜਾਂ ਜੇਲ੍ਹਾਂ 'ਚ ਜਾਂ ਮੈਂ ਮੈਡੀਕਲ ਇੰਸਟੀਚਿਊਟ 'ਚ ਜਾਊਂਗਾ ਜਾਂ ਫਿਰ ਮੇਰੀ ਮੌਤ ਹੋਊਗੀ ਸੋ ਉਹ ਚੀਜ਼ਾਂ ਨੇ ਮੈਨੂੰ ਪਰਦਾ ਦਿਖਾਇਆ ਤੇ ਫਿਰ ਇਵੈਂਚੁਅਲੀ ਉਹਨਾਂ ਨੇ ਛੱਡਿਆ ਹੁਣ ਛੱਡ ਕੇ ਮਦਦ ਜਿਹੜੀ ਉਹ ਕਰ ਰਹੇ ਆ ਡਾਕਟਰ ਲੂ ਐਜ਼ ਰੌਬ ਵਾਜ਼ ਮੈਂਸ਼ਨਿੰਗ he would leave this in between then come back to it. So that happens a lot with people who are suffering from substance disorder. What are the options available from your county or in general? What are the things they can do or the family can do?
I think just like with diabetes, think of it as a chronic condition, right? So you don't blame someone when their diabetes get out of control and you have to bring them back to care. Or even the diabetic patient has to be in the hospital because their blood sugar is so high, they get stabilized and then they come home. It's just the same. How Rob says that his substance use disorder is a journey, a lifelong chronic journey. Anyone with a substance use disorder should be treated as a person with a medical chronic condition. And that medical condition has now altered their brain function. So that then leads them to always actually crave that substance. So they're working very, very hard through talk therapy, through group therapy, possibly through medication to beat back those cravings. But life is hard and sometimes they don't fully succeed beating back those cravings. So be generous, be understanding of your loved ones when they do fail and then say, hey, guess what? We're just going to bring you right back into care. You kind of fell a little bit off the path. Let's bring you right back onto the path. Because again, you don't say any of those things to someone with diabetes. You'll be like, how dare you eat so many sweets and we're not gonna like talk to you anymore, right?
Yeah.
You say no, okay, your diabetes is bad, let's bring you back under control for your hemoglobin A1C. It's the same thing as alcohol use disorder, as meth, as fentanyl, opioid use disorder. That is really how we destigmatize those sufferings from substance use disorder.
Yeah, definitely it's the people around that person who need to be more aware how they can help other than triggering them to start doing this all over again. So people around generally speaking, Rob or Dr. Lou, if anybody wants to pitch in this one, people around that person, what are the things they need to do, like destigmatize, and what are the encouragement words you look for or that person looks for to leave this?
Go ahead, Rob.
Okay, thank you. I think the big thing is don't give up on the person. just like Dr. Lou said with, diabetes, we keep plugging along and we keep helping the person out when they hit roadblocks.
Mm-hmm.
Substance use disorder is the same thing. We may get to the end of the road with somebody and want to give up, but we have to realize that we don't give up on the people we love. We don't give up on the people we care for, because there's always hope there. People can always change. Unfortunately, people die of these diseases every day. But we strive to make changes in people in their lives so that they don't become that statistic. So don't give up. Keep loving them. It doesn't mean you have to be a codependent, and every time they want to borrow $10, give it to them because you know where it's going to go. But it means if they're hungry, go buy them some food and not give them the money.
Yeah.
Those kinds of things.
ਸੋ ਜਿੱਦਾਂ ਦੱਸ ਰਹੇ ਆ ਵੀ ਜੇ ਤੁਹਾਡਾ ਕੋਈ ਪਿਆਰਾ ਜਾਂ ਲਵਡ ਵਨ ਇਸ ਤੋਂ ਪੀੜਤ ਆ, ਆਸ ਨਾ ਛੱਡੋ, ਉਮੀਦ ਜਿਹੜੀ ਉਹ ਜਗਾ ਕੇ ਰੱਖੋ। ਉਹਨਾਂ ਨੂੰ ਮਦਦ ਦੀ ਲੋੜ ਆ। ਜਿੱਦਾਂ ਆਪਾਂ ਸ਼ੂਗਰ ਵਾਲੇ ਬੰਦੇ ਨੂੰ ਨਹੀਂ ਕਹਿੰਦੇ ਵੀ ਜਾ ਜੇ ਤੂੰ ਹੁਣ ਮਠਿਆਈ ਖਾਧੀ, ਜਲੇਬੀ ਖਾਧੀ ਤੇ ਤੈਨੂੰ ਅਸੀਂ ਬੁਲਾਉਣਾ ਨਹੀਂ। ਸੋ ਮੰਨ ਲਓ ਕੋਈ ਇਸ ਤੋਂ ਪੀੜਤ ਆ ਤਾਂ ਉਹਨੂੰ ਹੌਸਲਾ ਦੇ ਕੇ ਜਿਹੜਾ ਉਸਦਾ ਕੰਮ ਇਹ ਛਡਾਉਣਾ ਆ, ਉਹਨੂੰ ਥੱਲੇ ਨਹੀਂ ਸਿੱਟਣਾ, ਉਹਦੀ ਮਦਦ ਜਿਹੜੀ ਉਹ ਕਰਨੀ ਆ। I know time is running out. A lot of youngsters are also falling to this. Even in schools and everywhere, there's a lot of peer pressure around these situations. How do parents look out for those kids? What they should be talking to them? How can they help?
I'm going to start, but then Rob, please feel free to chime in, because Rob actually runs a really cool program at several local schools in Sutter County and Yuba County that he can talk about. So alcohol use for those, any under age 21 is considered underage drinking, and we do not recommend that. Right. And the reason we don't recommend alcohol drinking for those underage is because your brain is still growing. So the front part of your brain is still being formed. All those nice grooves that allows you to think and make executive function. So if you start prematurely ingesting toxins, essentially, because tobacco, alcohol, any other drugs, they're technically just toxins, then you are putting yourself at risk of damaging your brain function, and it's inhibit its ability to grow and expand. Rob, you want to chime in about your program?
Sure. So one of the cool things that we have a youth treatment program here at Sutter Yuba Behavioral Health, where either a person age 12 to 18 can walk in on their own, or the parent can bring them in. I think the biggest thing for parents is know who your kids' friends are. The biggest trigger is if your kids are hanging around with people and they don't want you to know who they are, there's a problem there, right?
Yeah.
All of a sudden,
something.
All of a sudden your kids are acting different than they did. They're withdrawing. They want to stay in their room. They don't want to go out with the family. They don't want to go to cultural events. Those are all things to look at to say there's something going on here that we need to get, down to. And, if somebody is drinking alcohol, that's a little bit easier to detect than if they're doing drugs, because alcohol has an odor. They wake up with a hangover. They may go over to a friend's house and they may smoke marijuana or something. There's a chance that you might know that or might not know that. But also there's drug test kits that you can buy at any pharmacy, at any drugstore. So you can test your kids and find out what's going on before it is too late.
So Dr. Lou, Rob, if somebody wants help in your county, how can they go about it?
Go up to see Rob at Sutter Yuba Behavioral Health. So Rob, do you want to give the contact information? How they
I
can
would love
contact
to.
you? Yeah.
Thank you. So we're at 1965 Live Oak Boulevard, and our phone number is 530-822-7200. You can speak with reception. On Tuesdays and Thursdays, we have an open clinic that anybody can walk in and talk to one of our counselors or myself, and we can go from there. They can also give us a call if they just want to talk to us on the phone and get some information. We'll always be glad to help with that.
All the information is confidential.
It is. It's confidential. Substance use disorder treatment is more tightly regulated than medical records.
Okay.
And so people could come in, and unless they sign a release saying they want somebody else to know, it all stays in house. It doesn't go anywhere.
Welcome. Dr. Luu?
Yeah, I just want to also say that that is going to be mainly for Medi-Cal insured individuals. For those who are privately insured, please turn around your health insurance card and call that member services number. And they, by regulation, must assist you. Right. So do not be shy about requesting services, whether it be counseling therapy, group therapy, or appointments to see a doctor to even get medication.
ਓਕੇ ਸੋ ਜਾਂਦੇ ਜਾਂਦੇ ਜਿੱਦਾਂ ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਡਾਕਟਰ ਲੂ ਨੇ ਵੀ ਚਾਹੇ ਤੁਹਾਡੇ ਕੋਲ ਮੈਡੀਕਲ ਆ ਚਾਹੇ ਤੁਹਾਡੇ ਕੋਲ ਪ੍ਰਾਈਵੇਟ ਇੰਸ਼ੋਰੈਂਸ ਆ ਆਪਣੀ ਜੇ ਤੁਹਾਡੇ ਕੋਲ ਪ੍ਰਾਈਵੇਟ ਆ ਤਾਂ ਪਿੱਛੇ ਉਹਦਾ ਨੰਬਰ ਹੋਊਗਾ ਉਹਨਾਂ ਨੂੰ ਕਾਲ ਕਰੋ ਤੇ ਉਹ ਤੁਹਾਨੂੰ ਨਾ ਨਹੀਂ ਕਰ ਸਕਦੇ ਇਸ ਦੇ ਵਿੱਚ ਮਦਦ ਕਰਨ ਤੋਂ ਬਾਏ ਗਵਰਨਮੈਂਟ ਰੈਗੂਲੇਸ਼ਨ ਉਹਨਾਂ ਨੂੰ ਤੁਹਾਡੀ ਮਦਦ ਕਰਨੀ ਪਊਗੀ ਜੇ ਤੁਸੀਂ ਯੂਬਾ ਜਾਂ ਸਟਰ ਕਾਊਂਟੀ ਦੇ ਵਸਨੀਕ ਹੋ ਤਾਂ ਤੁਸੀਂ 1965 ਲਾਈਵ ਓਕ ਬੁਲੇਵਾਰਡ ਤੇ ਜਾ ਕੇ ਜਿਹੜਾ ਬਿਹੇਵੀਅਰਲ ਹੈਲਥ ਦਾ ਇਹਨਾਂ ਦਾ ਡਿਪਾਰਟਮੈਂਟ ਆ ਉੱਥੇ ਜਾ ਕੇ ਮਦਦ ਲੈ ਸਕਦੇ ਆ ਟਿਊਜ਼ਡੇ ਮੰਗਲਵਾਰ ਤੇ ਵੀਰਵਾਰ ਥਰਸਡੇ ਨੂੰ ਓਪਨ ਕਲੀਨਿਕ ਹੁੰਦਾ ਆ ਤੁਸੀਂ ਉੱਥੇ ਜਾ ਕੇ ਸਿੱਧਾ ਵਾਕ ਇਨ ਕਰ ਸਕਦੇ ਆ ਤੇ ਹੈਲਪ ਲੈ ਸਕਦੇ ਆ ਜਾਂ ਇਹਨਾਂ ਦੇ ਫੋਨ ਨੰਬਰ 5308227200 530 822 7200 ਤੇ ਕਾਲ ਕਰਕੇ ਗੱਲਬਾਤ ਜਿਹੜੀ ਕਰ ਸਕਦੇ ਆ ਸਾਰੀ ਇਨਫੋਰਮੇਸ਼ਨ ਇਹ ਗੁਪਤ ਹੁੰਦੀ ਆ ਤੇ ਕਹਿੰਦੇ ਵੀ ਇਹ ਬਹੁਤ ਹੀ ਜ਼ਿਆਦਾ ਰੈਗੂਲੇਟਡ ਆ ਜੇ ਤੁਸੀਂ ਆਪ ਨਹੀਂ ਚਾਹੁੰਦੇ ਤਾਂ ਇਹ ਇਨਫੋਰਮੇਸ਼ਨ ਕਿਸੇ ਦੇ ਨਾਲ ਵੀ ਸ਼ੇਅਰ ਨਹੀਂ ਹੁੰਦੀ ਈਵਨ ਮੈਡੀਕਲ ਰੈਕਰਡਸ ਦੇ ਨਾਲੋਂ ਵੀ ਜ਼ਿਆਦਾ ਇਹ ਜਿਹੜੀ ਇਨਫੋਰਮੇਸ਼ਨ ਆ ਉਹ ਤੁਹਾਡੀ ਕੌਨਫੀਡੈਂਸ਼ੀਅਲ ਰਹਿੰਦੀ ਆ ਡਾਕਟਰ ਲੂ ਮਿਸਟਰ ਰੌਬ ਗ੍ਰੀਅਰ ਥੈਂਕ ਯੂ ਵੈਰੀ ਮਚ for joining me today and talking about alcohol use disorder. Hopefully it's just not for these two counties. In fact, anywhere and everywhere people who are listening, they can use this information to help themselves and their loved ones. Thank you very much for sharing that.
Thank you very much.